I'm Derek Dixon. I'm one of the current PGY2s here at the University of Kentucky Physical Medicine Rehabilitation program. I'm sitting here today at Cardinal Hill Rehabilitation Hospital, where our residents do our second, third, and fourth year inpatient rotations. I'm going to be talking to you today and kind of taking you on a little tour of Cardinal Hill and talking about sort of my day-to-day of what I do on the inpatient side of things. Usually my day typically starts around about 6:30. I get to Cardinal Hill around then. I usually sit down, go through my patients, checking vitals, labs if they were done from the day before, or updates, and just checking notes from nursing, see if there's anything that I missed or need to follow up on. Usually the rest of the team is here by 7 a.m. We typically round together as a team on all of our patients in the morning. I don't do any kind of pre-rounds on my own other than just chart checking. Our team is usually made up of one attending and a resident on the team. Typically we usually have students with us as well. It sort of depends on the season. If we have occasionally fourth year medical students from UK will come with us and stay for about a month, or we'll have auditioning students depending on the time of year if we have students that are interested in the program. Sometimes on the units we'll have PA students from UK who will come as well. Like I said, we round as a team. The team is always just one resident, so we don't have any interns with us. We pretty much serve as one resident on the upper level on that team. We'll go and see our patients, talk to them about any problems they may be having, kind of discuss their care and what we're planning on doing that day. After that, we'll sit down, usually as a group. We'll run the list together, make sure that everybody from attending to student is on the same page with the plan for the patient for that day. What we're doing, we use this time also to just kind of discuss any issues that we may have with different patients that may have come up, or talk about some pathophysiology. It's a chance to kind of do some teaching and things and talk about why we're doing what we're doing. After that, usually my day is back on the computer. I'll be putting in orders first. We always do our orders come before anything else, and then I'm starting to work on my notes. It's during this time too, and really kind of all throughout the day, that I can get pages at any point. The pager system works pretty basic. Just the nurse, therapist, or anybody needs something, they put in the number that calls to my pager. I can then call that number back, and if it's a question I can answer right away, I can do that there, kind of explain the reasoning for that, or sometimes I have to go on the floor and either see a patient if it's something more urgent, or just go and talk to the team about any issues that may come up. Typically that's kind of the start with my morning. Try to have kind of a lunch around noon, but there's definitely no lunch breaks. Sometimes we have to work through it, of course. After that, we're starting to get admissions during the day. Now, the process for admissions coming here typically involves the admission liaison or the admission team here at Cardinal Hill and the admission team at the other hospital, wherever it may be. Most of our patients here at Cardinal Hill we see come from University of Kentucky. That's where we get the majority of our inpatients coming from there. We do see other hospitals in the area though, such as Baptist Hospital and other places will, including the VA, will send us patients occasionally. When we get an admission, typically the admission liaison will call the attending. They'll call me as well. Just kind of say, here's the person that we're getting. A lot of times they know what time they're being transported over to Cardinal Hill, so it kind of gives me an idea of how much I can work on then. That's typically pretty much my day. Like I said, the admissions get here, we go and see them, we put orders in. I'm usually finishing up my note, writing all the details and stuff that happened to them while they're at the acute care hospital, and then things that I saw after talking to the patient, things on physical exam. After that, I'm usually done. Typically it's around 5 p.m., but sometimes a little bit later than that. And that's pretty much my day. I appreciate you guys watching this video, and enjoy you letting me kind of take you on a tour of my day-to-day. This video was brought to you by the Student Council of the American Osteopathic College of Physical Medicine Rehabilitation, the AOCPMR. If you guys have any questions about our organization or physical medicine rehab in general, please reach out to the Student Council PR department through the AOCPMR Council. Thank you.